Okay, so you're about to go and start your new life, okay?
Yeah.
What are you always going to make sure you do? Discipline.
So this is on.
Yeah, that's on
2
him.
fingers gap and 2
Yeah.
bar. So 14 for now.
Yeah,
Pretty good level.
good,
Yeah.
good, okay? So we can always start with vibrate. So,
P.
yeah, so let's hold on to P, dangle the ball in front of him. If he jumps up, vibrate. Vibrate. So you can see we gave him a chance there, he didn't. Go straight to your stem and tell him out.
Out.
See the difference, yeah?
Yeah. Sit.
So we're fair in our discipline.
Yeah, yeah.
If we didn't need to stim him, we wouldn't stim him. Clearly, he couldn't give a fuck.
Yeah.
Ask him to down.
Down.
Tell him leave
Leave.
and dangle it in front of him.
Leave.
Right by his mouth.
Leave.
Down
Leave.
him again. If he comes up, vibrate and down him.
Down. Leave. Leave. Leave.
Okay, sir, moment of truth. We know beyond a reasonable doubt that this dog going into that boot, difficult one. Yeah. And there's going to be a residual resistance there. And this is where the leash skills is going to work. So do I know what the outcome will be? I'm pretty confident. Yeah. And it's all about your leadership. Okay? You've got to approach it. You've got to be meaningful. And you've got to tell him up. Yep. Okay. All right. Open your boot. So just to look back at the camera, he would ordinarily not have done that, right? In fact, you have to start putting him in the side. Yeah. Yep. All right. And have we practiced this before?
No.
Okay. It's your second visit since you've been away, while he's been here on residential, and your second time applying a check and working with this type of leash. Yeah. Correct?
Yes, correct.
Right. Let's go. How long has the problem been?
We've only been trying to get sit. We've only tried it once about a few months ago.
Right. Circle. Yep. Circle. Right. Move with purpose. Yep. And then tell him up now.
Up. Good boy.
You wouldn't have done that before.
No, I mean, we had a ramp before. I think the ramp confused him. But I mean...
Right, come out.
Out. Cool.
Okay. Now you're not going to use your leash at all. You're going to just approach and tell him up.
Sit. Sit.
Approach and then tell him up.
Up.
There we go. So, who have we got here?
This is Check.
Check. He came in with serious aggression issues, right? Even you yourself, everybody was very intimidated.
Yeah.
And now he's looking rehabilitated, right? He had been to the vets. He had a chronic ear infection, and we've treated that. So let's do some repetitions of here, sit, and down.
Sit. Sit. Down.
Okay.
Sit.
I don't want you to lure the down next. Lock it off and ask for the down.
Down. Yes.
Yeah.
Good boy. Well done.
Okay, good lad.
Sit. Down. Sit. Sit.
So remember, no. With this situation, you don't want to be too, you're going to feather, yeah? So watch my fist. There we go, okay? Superb. All right, let's do that again. So there's still boundaries, yep?
Sit.
He loves it, doesn't he?
Yeah. Down.
Okay, so balance training. Leash skills. We have the check chain. We have this young rascal that is kind of willful, right? Sometimes he's jumping up. He won't stop, but now you can correct that with the check. So there's a consequence to the behavior, right? Also, he wouldn't go over agility stuff. We managed to do that yesterday. And putting him in that type of crate is going to be quite problematic normally, yeah? Okay, so approach now. Okay. All right. And just tell him in.
In.
That would have been near on impossible, right?
Down a little bit further. Sit. Sit. Over.
So at the end of this next 2, we're going to reward him.
Back. Over.
Don't worry, every time he jumps, now reward him.
Good boy.
Good lad.
Good boy.
But never let him to jump up and take it out of your hands, yeah?
Okay, yeah, give me
Yeah. I mean, you could see that this dog, there was no bloody way you could do this off leash without an e-collar on this dog. Yeah. It would have been mental. Call him back to you.
Here. Here.
So it's quite hot for him. We're going to do one last thing.
Sit.
He's going to go over that A-frame. He's never done anything like that before, but he's going to do that today.
Sit.
It's okay. He's gassing out already. Yeah. He's hot. Grab the ball. Let's push him a little bit, and let's see whether he's going to go over, okay?
Heel. Heel. Good boy. Heel. Here. Here. Good boy. Good boy. Go over.
No, you're going to have to lure him over, yeah? Lure him over it, yeah.
Over.
Start again. Really motivate him.
Heel.
Your motivational conversation is weak.
Here we go. Heel. Here we go.
Go on, boy! Go on, son! Go on, son!
Yeah.
Go on, son! Go on, son! Yeah, well done.
Out.
That's remarkable, right? These are the impulse controls that I'm looking for. Handler respect. No, no, you punish that.
Okay.
Yep.
Down.
Yep.
Leave. Down. Leave.
If he comes up again, you're going to give him a stim.
Leave. Leave.
Step back and tell him leave.
Left.
Punish him right away. And tell him down.
Down. Leave.
Swing it around, tell him leave.
Leave.
Punish him if he gets up.
Down.
There we go.
Leave. Leave.
You see, when we get this handler respect, and we do this over the next few weeks, we're laughing. Hello, sir.
Hello.
Final handover. So, what's your name?
Down. Down. Leave.
And what's your dog's name?
Check off.
Chekhov. A bit of a rascal before, right?
He's a nightmare, yeah, he can be. He's a handful.
And he's been with us for, I would say, nearly 5.5 weeks, nearly 6 weeks. Yeah. You've learned the e-collar masterclass.
Yes.
You've learned how to exercise him,
Yeah.
get good recall, get good downstay. This would have been problematic.
Down.
Yep.
Down.
Yep. And it's still a work in process. Yeah. Correct
Down.
him and say down at the same time. And you could jump to your boost. Yep. He loved the ball. You could never get the ball off him.
Yeah.
So what's the feedback that you have for us?
I mean, I'm really happy. Obviously, you've figured out what was wrong with his ear. He's a much calmer dog. He's a lot less reactive. He's listening a lot better.
He had a chronic ear infection, didn't he?
Chronic ear infection.
And we offered the health MOT.
Health MOT, which found it. We were able to treat it properly. We've had treatments before that haven't worked. This one seems to have really done a job.
We checked Chekhov's ears, and there is an infection on this right one. So now I took a sample of the discharge to test to see what bacteria are growing there, and I'm giving it a clean, and depending on what we see on the slide, we'll give him medication. It could be, well, why he was being a bit more aggressive than usual, because this can be quite painful.
And yeah, he still has a lot of, I want to push daddy around, you know, and it is punishment. It's his choice. He has a choice to misbehave or not misbehave, you know. So you got to make sure you do that. He knows better. We know that he's driven by the ball, but he doesn't dictate when that ball is taken. I mean, before, we couldn't even get him to out a ball. So you must practice all of this. We need to definitely check the ears to make sure that it's not reoccurring. And obviously we'll speak to our vets. If there's anything else we need, we can post that out to you.
Okay,
yeah?
cool.
All right, okay. I wish you the very best of luck. It's been a pleasure. You're a very committed owner.
Okay, here we have Chekhov.
He's a Rottweiler cross Mastiff and he's in for a full health MOT today. So we're going to be checking everything, just checking that he's comfortable everywhere. We're starting with checking his teeth to see if any are causing him pain or might need extracting.
Never before has behavioral modification become synced with veterinary care. And we are in the position to do health MOTs to check to see if a canine that's reactive has reservoirs of pain. It could be arthritis, it could be spinal infusion, it could be dental abscesses. In Check's situation, he had a very, very chronic ear infection, which we have treated. And he's now on the road to recovery to be a stable member of society.